In this segment, we're going to be looking at the crossbite. So a crossbite can be a unilateral or bilateral. Now, what happens is normally the top teeth erupt on the outside of the bottom teeth. But over on this side, you can see the top teeth have erupted on the inside of the bottom teeth. Now, that also develops when normal function parameters are not met or have been interrupted. And it is associated with a narrowing of the palate. There is two kinds of crossbites. We're just looking at a static crossbite here. Later on, we're going to look at a functional crossbite. But what a crossbite will do after it has begun to form is it restricts the growth of the maxilla on the side that the crossbite is occurring. So that means that those top teeth are locked in on the inside of the bottom teeth, and it stops the palate from growing on that side. So the possible causes are a prolonged pacifier or dummy use. And one of the reasons is because oftentimes when the kids are using a dummy, they're sucking, again, quite hard with a round object in their mouth, and the palate is narrowing. Sometimes a crossbite will occur on one side. Sometimes it can occur on both sides in that respect. Mouth breathing often assists a crossbite. And again, that low tongue resting position. Crossbites can be reversed in very, very young children. And that's just by getting normal function back. So if you have a little tiny one who is looking like they're developing a crossbite and you remove the causative factor and then you remediate that muscle function, then that crossbite can be reversed. Sometimes it will just self-reverse, but I like to think that we can assist that, particularly with the use of a myomunchie. If the 6-year-old molar is in crossbite as well, that's a permanent tooth, they should definitely have some orthodontic intervention there to help assist just moving that tooth out, because every time they're chewing up and down, that tooth is getting locked in position. But identifying a crossbite or a potential crossbite in a very young child is a super important thing to do. Again, look for the why. If you begin to see this happening in the patients that you're seeing, look for the why, look at their habits, and then plan where the myomunchie use can be of assistance in the remediation process.